The heart is an amazing organ, the most important in our body. It's responsible for circulating blood, oxygen, and nutrients around the body. The heart beats about 60 times every minute, and over the course of the human life, pumps millions of liters of blood through the blood vessels. It's this pumping action that supplies the body with oxygen and nutrients. The heart is made up of muscle tissue and has 4 chambers. The upper 2 chambers are the right atrium and left atrium. The lower 2 chambers are the right ventricle and left ventricle. Blood is pumped through the chambers, aided by 4 heart valves. The valves open and close to let the blood flow in only one direction. The left valve is called the aortic. It regulates blood flow from the left ventricle to the main artery, the aorta. This main artery distributes the oxygenated blood to all other body organs, including the heart, by way of the coronary arteries. These arteries wind around the heart to keep the heart muscle supplied with oxygen and nutrients for its continuous pumping job. The narrowing and hardening of the arteries is the most common form of damage to the cardiovascular system.
Cardiovascular disease is a term that incorporates conditions that affect your heart, the heart's blood vessels, and the other vessels around your body, including your peripheral vessels in your legs, your arms, and so forth. It also incorporates conditions affecting the brain and its blood supply.
As you know, the heart carries oxygen throughout the body, to every organ, every limb in the body. So anything that goes wrong with the heart can affect certain parts of the body. Anything that affects the blood vessels can also affect parts of the body.
Cardiovascular diseases include mild heart attacks, strokes, disturbances of kidney functions, and reduced blood flow to the entire body. The weaker the heart, the smaller the volume of blood ejected with each heartbeat, and the poorer is the blood flow. The tissue fluid that is normally removed via the veins cannot be removed. Abnormal accumulations of fluid, also known as edema, develop in various parts of the body, especially the feet and ankles. This sometimes results in amputation.
The common risk factors that you should know about are things such as high blood pressure, what we call hypertension, high cholesterol, hypercholesterolemia, hyperlipidemia, hypertriglyceridemia, broadly called dyslipidemic syndrome, diabetes mellitus, smoking, excess alcohol consumption, sedentary lifestyle, obesity. These are all risk factors that we have to always consider when talking about cardiovascular disease.
In Grenada, the prevalence of cardiovascular disease is quite high and should not be taken lightly.
Cardiovascular disease is as common today with a prevalence of about probably 60%, affecting those over the age of 55. So we're saying roughly 2/3 of all patients or people above the age of 55 have some degree of cardiovascular disease or significant cardiovascular disease. Mind you, we're all at risk and we all have some degree of pathology going on within our hearts or blood vessels. But roughly 2/3 of our population have some significant cardiovascular anomaly that has to be addressed. It is something that is kind of the tip of the iceberg. What we tend to see people when they come in, they're very ill, they have a heart attack, they have a stroke or some other complication. But a number of people out there that don't seek medical attention, don't get diagnosed early enough. Some of them unfortunately pass on before it's picked up. So, you know, it is significant, but it's not anything more than or more startling than any other part of the world. In developed countries, statistics vary between 40 to 50% in North America for the same particular problem.
Symptoms of cardiovascular problems may include headache, chest pain, shortness of breath, and fatigue. The most common type of cardiovascular disease in Grenada is hypertension.
The main one is high blood pressure, or what you call, you'll say somebody is hypertensive. Hyper meaning high, hypo we get in the very young. We find the young patients have very low blood pressures because sometimes they don't eat properly, they don't drink enough water, so the heart doesn't have enough volume to push around to the organs. Hypertension is the pressure that the vessels undergo to push the blood around to the different organs, and then back to the heart. So that is what you measure when you measure high blood pressure, when you measure the pressure, a patient's pressure. And it can either be high or it can either be low. The reading you get when you take somebody's blood pressure is two readings. You get a top figure, which is called the systolic blood pressure, and then you get the bottom figure, which is called the diastolic. Anything above 130 systolic is considered high blood pressure. Anything above, it used to be 90, but I think the World Federation has bring it down to 85. So anything above 85 is a high diastolic. So if somebody comes in with a blood pressure of 140/85, you say to them, you have what you call a borderline blood pressure. And you will advise them to have their blood pressure checked either on a weekly basis or on a monthly basis so that we can monitor their tendency. They're probably heading towards having high blood pressure.
A tendency to hypertension may be hereditary in some cases. However, medical experts have proven that stress, lack of exercise, excessive fat, and salt intake favor the development of hypertension.
It's usually due to blocked blood vessels, and this could be due to a high blood sugar, which you would get in diabetic patients, or you would get it with alcoholics. Because of the buildup of the alcohol, it causes the blood vessels to get blocked. You can also get it with high cholesterol. The cholesterol forms, the bad cholesterols form around inside the lumen of the blood vessels, and it's like a drain that gets blocked, so you have to use more pressure for the blood to push the volume of fluid through the body. Smoking can also cause the buildup of different things within the blood vessels. The way we measure the carbon monoxide levels in the blood is with what we call an equalizer machine. And this measures the carbon monoxide, and it's done mainly on patients that have a history of smoking, whether it is just cigarettes or whether they smoke marijuana or any other stuff. High blood pressure is what we call the silent killer, because by the time a patient would realize that something is wrong, they may just complain of a headache. And again, this is the pressure with the blood trying to push through your brain. And they may complain of a headache, so they may go to their doctor, and sometimes by then it is so high that the doctor has to treat it right away. So a patient cannot tell when their blood pressure is high unless they do regular checks with their doctor, and we advise that you do a yearly check with a doctor just to make sure that your blood pressure isn't climbing.
To make a proper diagnosis of any cardiovascular disease, patients go through a detailed, painless screening process where their blood pressure is analyzed and the heart is checked for problems using an electrocardiogram or EKG test.
When you come for the check and you have your blood pressures done, and normally it's taken 3 times in the right and once on the left arm. And those readings, we take it 3 times so that, sometimes you just come in and you might be excited, you might be a bit nervous, so you may get the first reading very high and then the others may settle down. So that's why we take 3 readings. And that's the only way you would be able to check somebody's blood pressure. If you do the cholesterols and the cholesterols are high, this will also indicate that the patient is heading for some sort of cardiovascular disease. After which we do the ECG, and that also will tell us. Doesn't always mean that somebody with high blood pressure would have a bad reading on the ECG, but it can indicate that there could be problems, especially if they're overweight. So those are the first tests that any doctor, any clinic would do to see if somebody's heading for cardiovascular disease. We measure the pressures in the legs, as that gives us an indication as to the circulation to the feet. The body has a way that it sends blood mainly to the big organs first, and most times your feet is it's usually the ones that get affected when you have cardiovascular disease. Exactly the same way, because the blood vessels get blocked, it affects the circulation to the feet. So what the equalizer does, you do it exactly like you would do a blood pressure in the arm. You put the cuff around the leg and you use a Doppler machine. And this measures the deep vessels, the arteries. Depending on the sound, somebody that's an expert in vascular disease will be able to tell you exactly what's happening to that artery. There is a measurement that we take, and it goes from 0.9 to 1.35. If it's under 0.9, it means that the patient has very poor circulation. And you get that with diabetic patients, because diabetics suffer a lot with their feet because of the circulation once again. If it's above 135, this we normally find with the elderly, and it's just wear and tear on the vessels in the legs.
The Grenada Heart Project provided screening for up to 5,000 Grenadians who were part of a survey facilitated by the World Heart Foundation and the Government of Grenada's Ministry of Health. The data from the island-wide survey assessed how lifestyle changes in poor and developing countries could affect people's health and what necessary medical interventions were needed.
We are testing for the prevalence of heart disease and stroke in Grenada among all classes of people, because we have used the voter registration list to do a random sampling of 20% in each area, each village, to come up with the names of the people. These people are notified by field workers we have out there, and then they come in to get a testing done. We have over 1 million people a year worldwide dying from cardiovascular diseases. So it's one of the things that's affecting everybody. And because we are a developing country and moving more in the North American lifestyle, you are finding that so many of us have problems that we wouldn't have normally had, like when I was much younger. But the change in lifestyle will cause people to get cardiovascular disease. So what this program sets out to do is to stop the epidemic, because healthcare is expensive, and if people know their status now, they wouldn't end up with a problem later on.
The St. George's University runs an amazing initiative that helps people look after their heart. Dr. Sylvester coordinates the cardiology program, which allows patients to attend monthly cardiovascular clinics at the General Hospital, managed by visiting cardiologists.
With that high degree of cardiovascular disease complications and mortality, we definitely need someone here more often than not. So what I do is I coordinate the monthly visit of a reputable credentialed cardiologist. Every month they come down, they spend roughly a week and see patients at the General Hospital and other facilities free of cost to all that have been referred. Things that we do normally during the week, including consultation, EKGs, echocardiography, they're all free. They're all free of cost. But sometimes patients do feel they need to contribute and make a donation, and we don't turn an eye to that.
Patients can be informed of the cardiologist's next visit by simply asking their family doctor or general practitioner. This will be the new home for all cardiology programs in Grenada. The multipurpose center, located on Grandans Main Road, will include the St. George's University Diagnostic Cardiology Center, which will provide a range of services.
2,400 square feet of floor space is going to be dedicated to cardiology services. So what we'll do is have outpatient clinics there on a monthly basis, just as we were having at the General Hospital or in other locations. But having it there solves one or two problems. It's central, it's easily accessible, and it's still free. The St. George's University Visiting Cardiology program has developed significantly within the last few years. We've been able to provide free, accessible, quality healthcare from reputable, credentialed cardiologists. We've been able to do that on a regular basis, offering good continuity of care. We have a longitudinal program, a plan, where we have certain cardiologists coming back sometimes twice a year to see the same patients. Things that we do normally, consultation, echocardiography, EKGs and so forth, will still be offered free of cost to all appropriately referred and attending our clinics. This year we're going to take it up a notch or two. We're going to provide more advanced cardiac interrogation, investigations, namely stress echocardiography, that's like a treadmill test, okay, and other stress tests in particular, okay. I don't want to be too specific, but we have a few things planned. We also facilitate pacemaker interrogation and pacemaker implantation when necessary. The program facilitates the attainment of tertiary level of cardiovascular care and intervention in the United States and other places where some patients need some degree of intervention. Some people need to go away to get angiography, stents, and so forth placed, and we can't offer that kind of service here in Grenada presently. So we facilitate that, and we have a few patients that we've been able to get that help for in the US, sometimes for free. We're hoping to see the program continue, develop, and hopefully with the completion of our new facility, we will have patients wheeled in with no problem, because it's going to be completely disability friendly through and through, and still achieve that level of care that they would probably get when they go away to the United States or the UK or Canada or somewhere like that, without the added cost of travel and stress.
The risk of heart disease can significantly be reduced by applying simple lifestyle changes.
It can be prevented by a healthy diet to start with. Lots of vegetables, lots of fruit. Less frying, steaming and boiling is the best way, or if you can eat your vegetables raw, That's the healthiest way to have it. Drinking lots of water, especially in a hot country like Grenada, where you perspire and you excrete a lot of fluid. By perspiring, you need to put that fluid back, because this also causes kidney problems, because the kidney gets rid of all your salts and different things, and if you don't drink, your kidney has nothing to work on. Exercising, lots of walking, swimming, any exercise that can work the heart and get the heart working is very important, and regular checks with your doctor.
We all at risk, we all will have some degree of plaque buildup, some degree of cholesterol that could be worrying, that need to be addressed and mitigated. But how do you prevent yourself from dying early or having a morbidity problem, a complication before you get too old? And these are the things that we are trying to mitigate, the complications of cardiovascular disease and the sequel. Things that you could do. First of all, you need to seek medical attention early if you have any symptom that you think is worrisome, or you need to also see your doctor for an annual checkup or a biannual checkup, as the case may be. Some people don't need to go to the doctor every year. So you need to seek medical attention, and especially if you have a problem, if you have a symptom, you got chest pain, a discomfort, you got shortness of breath you can't explain, etc. Early detection and diagnosis can lead to early treatment. You should have faith in the health system. You should have faith in your doctors. You should have faith in your nurses. You should speak to them. Feel free to ask them questions and also to listen to them. One of the things I always encourage patients to do is to be compliant with your medication in particular. Be compliant when advice is given with respect to behavioral changes. And these are simple things that we can do. We can modify things that we do. We can't change our genes, but we can exercise more frequently, do the right type of exercise. We could eat better, including low-fat diets, etc. If you're diabetic, there are specific diets that are tailored for you. If you have high cholesterol, you also have to watch a particular diet, in terms of fluid management, how much you drink, etc. These are things that you can do. If you smoke, you need to stop smoking. Easier said than done sometimes, so you got to cut back and go on a program that will help you. You need to drink less alcohol or no alcohol at all. Okay, so these are things that you don't need a prescription for, but you need that control from within, that empowerment. So education is important.
With a little knowledge about your heart and what is good or bad for it, you can significantly reduce your risk for heart disease and therefore live a more healthy life. If you want to learn more about cardiovascular disease and to find out if you're at a high risk of developing it, please contact your family doctor or general practitioner. Early diagnosis can save a life.